My name is Tracey Naledi. I am the Deputy Dean for Social Accountability and Health Systems at the Faculty of Health Sciences at the University of Cape Town in South Africa. If I had to choose one word to describe my hopes for the 18th World Congress, I would cheat a little bit and actually ask for two words, because my two words would be transformative conversations. And I say that because the Congress will bring together people who don't usually share the same space, who come from different disciplines, from different sectors, from different lived experiences, from different geographies. And when we as human beings use our voices to truly engage with an open mind and an open heart, those conversations don't just inform us of information and knowledge, but they can truly shift how we think, how we see the challenges in front of us, what we prioritize, and how we act and how we move forward to truly change the world. And I believe that if we can have these transformative conversations, this is where change can begin towards a better world where everybody can be the best that they can be. So when I return home from this event, change for me would be articulated in three C's: clarity, connection, and courage. Clarity to see the complex health inequity issues that we face in the world, and clarity to see them through multiple lenses and hopefully new lenses that we hadn't considered before. Connection to people and ideas that we would otherwise not be able to encounter. Encourage to innovate differently and collaborate across boundaries rather than working in silos. So if I could return from the Congress, and if any of the participants could return from the Congress thinking slightly differently, working slightly differently, and partnering more boldly with different partners, then I think this Congress would have done its work. Powerful example from my region, and is from Zimbabwe, that has allowed an application of knowledge from a different context and a cultural context. I mean, there are many, but the one I want to highlight is the Friendship Bench from Zimbabwe. As we know, in the world, we've got inequity in terms of access to mental health services. And in low middle income countries, that inequity of access is quite stark. So in Zimbabwe, one of the psychiatrists there really innovated to address the mental health treatment gap by drawing deeply on African principles of storytelling, of relational care, of problem solving through trusted community members, and particularly elders in the community, rather than the clinical hierarchy. And within this friendship bench approach, what they did is that they created these safe spaces where community members, elders and gogos and kulus could sit and be available for people to come and talk to them around some of their mental health challenges. And what makes this, for me, a powerful example is that it's an example that is very locally grounded, that is culturally kind of culturally grounded, and it's a model that actually has not only been relevant for Africa, that has since been adapted using a context from different languages and cultural contexts, including in high-income countries. And the significance of this, and the reason I'm highlighting it, is that it reminds us that innovation does not only flow from north to south, that innovation also flows from south to north, where the world can learn from Africa. And so I think this Congress being in Cape Town in Africa also allows us that opportunity. Hosting the World Congress on the African soil truly signals a shift in the recognition that public health knowledge does not only originate from the North, that public health knowledge actually can originate anywhere. And this being in the African soil, we have an opportunity to showcase knowledge that originates from Africa. And I think for too long, solutions have been framed as flowing from north to south. Yet we have many examples, and I think the HIV space is a very good example where we've shown how African health responses have informed global practice. Some examples around community-based prevention, around task shifting, around using social accountability principles, and working across sectors, and particularly around the value of engaging with communities and the value of actually bringing communities along with you as you innovate, as you implement. And so we do have these examples where actually information and knowledge and innovation can flow from south to north. And so what we are doing is preparing our members and preparing people in the global south and in Africa in particular to prepare themselves to come and be contributors, to come and share their work, to come and share the knowledge that they've generated to the global public health community, not just as recipients of information. And obviously, we are very excited also to hear and learn from our colleagues from around the world, but we are absolutely also coming onto the stage as credible knowledge generators and as equal partners in the world, that we also can contribute in terms of sharing contextually grounded evidence and our ability to actually scale up system level innovations, our ability to build partnerships that recognize our public health experience. And we are here to show how some of these principles and some of the knowledge that has been generated in our context actually has shown to solve some of the global health and some of the challenges and the health equity challenges in the world. A year from now, I would call this Congress a resounding success if the conversations and the relationships that we have formed in the Congress have truly translated into action. What I mean by that is that I hope that we make connections with each other that will result in joint projects that are across sectors, across disciplines, across geographies, where we can have shared learning, and that shared learning can translate into concrete changes in policy, in practice, and really and start to show some visible outcomes. If the conversations that we start and hear and that we have can continue to shape how we do our work, who we do our work with, how we pursue our agenda of ensuring health equity, then I think the Congress will have moved from beyond being just an event, but to becoming a catalyst for change and a catalyst for health and well-being in the world.